Good morning, everyone. Today's topic for presentation is biological aspects of dental implants, a soft tissue interface. Dental implant is an artificial titanium fixture that is placed surgically into the jawbone to substitute missing tooth and its roots. This topic is dealt under two headings. One is hard tissue interface, which has been covered in the last lecture, and a soft tissue interface, which I'll be dealing today. Healthy soft tissues surrounding a dental implant is essential for health, function, and aesthetics. During the development of a tooth, there will be formation of biological connection between two living tissues. The similar type of connection is expected to be created during the healing process after placement of an implant. But the connection established in case of an implant will be between a living body, living tissue, and a non-living body. The success of dental implant is dependent on the establishment of soft tissue barrier that is able to shelter the underlying osseous structures and the osseointegration surrounding the implant body. Aesthetics related to dental implant prosthesis depends on the health and stability of peri-implant mucosa. Understanding of soft tissues, healing, and maintenance around the dental implant is of paramount importance for a successful implant. Peri-implant soft tissues appear more similar in structure to periodontal tissues. As you can appreciate in this picture that there is more similarities in soft tissues between tooth and implant, and there is absence of cementum and periodontal ligament, which you can see in this picture. A protective barrier is formed around implant by soft tissue integration, which include the epithelium and connective tissue, that helps in formation of soft tissue seal protecting the bone surface from microbial challenges of oral cavity. So epithelia, oral epithelium and junctional epithelium, both epithelia form a tight sealed intercellular spaces by numerous desmosomes contributing for lower permeability for entry of microorganisms. Keratinization process also acts as a defense mechanism for protection. Coming to histological schemes of epithelium and connective tissue, cuff-like circular orientation of fibers, bundles, creating soft tissue around the implant. The connective tissue in direct contact with the implant surface is characterized by an absence of blood vessels and an abundance of fibroblasts interposed between collagen fibers. The dimensions of peri-implant connective tissue measures approximately 1 to 2 millimeters. Alignment of connective tissue fibers appears circular and horizontal around implant. Coming to vascular supply, there will be scarce blood supply in the connective tissue cuff surrounding an implant. So vascular supply of peri-implant gingiva or alveolar mucosa is limited due to lack of periodontal ligament. So capillary loops in connective tissue under junctional epithelium and sulcular epithelium appear anatomically similar to normal periodontium. So coming to comparison of tooth and an implant, the connection in tooth is established by cementum, bone, and periodontal ligament, whereas implant it is osseointegration or bone functional ankylosis. Junctional epithelium appears in both hemidesmosomes and basal lamina appear in both. Lamina lucida and lamina densa is more seen in case of normal tooth, whereas in implant there is lamina lucida, lamina densa, and sublamina lucida zone is an addition. And connective tissue appears perpendicular. The fibers appears perpendicular to the tooth, whereas in implant it is more circular and parallel. Junctional epithelium measures 0.97 millimeters, whereas in implant 1.88 millimeters. And biological width in case of normal tooth it is 2.04 millimeters, whereas in implant it can be 3.08 millimeters. Vascularity is more in case of a normal tooth and less in case of an implant. Probing depth appears 3 millimeters in normal tooth clinical depth and 5 millimeters in case of a up to 5 millimeters in case of an implant. Bleeding on probing is more reliable marker for disease in case of a tooth, whereas it is less reliable in case of an implant. Coming to biological basis for soft tissue healing around implant is studied under different headings. One is gingival shrinkage around dental implants, and keratinization, biologic width, and peri-implant seal. So coming to gingival shrinkage around dental implants, during the healing phase following implant uh, placement surgeries, that is stage 1 and transmucosal surgery stage 2, the soft tissue reorganization occurs by itself according to the new environment. The peri-implant gingival tissue appears to shrink during the early stage of wound healing. The longitudinal arrangement of major collagen fiber groups amplify the process of collagen fibril contraction in vertical direction. So clinically, the process is observed as marginal gingival shrinkage. In the anterior aesthetic zone, the amount of gingival shrinkage can be crucial to success or failure of an implant. Therefore, it is important to take into account the position and structural integrity of labial bone wall, which forms the support base for the labial gingiva. The second uh, point is peri-implant soft tissue seal, which contains junctional epithelium and connective tissue, and epithelium adheres to the titanium surface in similar fashion like in normal tooth. However, the connective tissue compartment there will be some amount of difference. The peri-implant tissue had has high fiber content and hence the lower cellular content than the gingival around the tooth. In addition, the collagen fibers are arranged parallel to the titanium surface and the satisfactory seal is observed around the implant abutment and is capable of maintaining tissue health in case where the plaque control is absolute. The next point is keratinized gingiva. Keratinized gingival zone is based on the data, the implant success and implant survival studies. So there appeared to be a little or no difference in the success rate of implants when it is placed in oral mucosal zone or keratinized gingival zone when there is absolute block control maintained. The fourth point is for discussion is biologic width, which is a combined length of junctional epithelial attachment and the connective tissue attachment, which refers to the height of the gingiva or peri-implant mucosal attachment apparatus around the natural tooth or implant. So, peri-implant tissue thickness and biologic width, there will be dimensions of soft tissue attachment to the implant abutment surface as considered important for the maintenance of peri-implant health and overall aesthetics of final restoration. So, for many years, the concept of biologic width was used to explain the clinical observation of constant dimension of dentogingival junction around tooth and dental restoration. So, similar constancy of gingival dimension was observed in peri-implant tissue as well. So, by surgically reducing the thickness of gingival flap prior to suturing, a corresponding crestal bone remodeling will subsequently allow for re-establishment of biologic width of peri-implant soft tissue to its original dimension at the expense of reduced crestal bone height. So, to summarize, you need to understand about the soft tissue connection between the implant protect as a protective barrier for an implant. Thank you.